Hello, hello, my friends. It's Jill Osborne from the Interstitial Cystitis Network. It is time for another IC support group meeting. It is, however, the morning after we lost an hour. So there you go. My family isn't still nobody's quite alert like we should be, including myself. I almost took a day off today just as a mental health break because it was a rough week last week. Hello, Facebook. Nice to see you. Hello, YouTube. Nice to see you. Little late. I might have to get up and help my mom. We'll see. We will see. Hello. How are you? How is your IC? How are you feeling? So I had kind of the challenge that we have with interstitial cystitis is that, hi, Donna. These are the symptoms we always associate with UTI, always. Or we always associate with our bladder: frequency, urgency, pressure, pain. And I've really come to kind of a new understanding, at least for me personally, that like the other day, no, yesterday, as a matter of fact. So I could start feeling my pelvic floor getting tight again. And it's hard to describe how I can feel it. It's like, Tara, thank you for the 50 stars. My urine stream isn't normal. It's like it hesitates. It's like you can tell that it's just not releasing urine easily, right? That there's this, it's just not quite as simple. I wish I could describe it more. You know how when you do a Kegel, and it's very hard to describe how you do a Kegel, where you pull your muscles in and then you release your muscles, and they call it releasing a rosebud. I know that when my pelvic floor muscles start to get a little bit tight, that release does not happen quite as easily. I mean, I can pee, but it's not easy. Hi, Lee. Hello, Boria. Hi, Karen. Hi, Tara. Tara, I'll come back to that. Endometriosis plays a huge role in IC. Okay, so anyway, so a couple of days ago, like 3 days ago, I started definitely noticing that my pelvic floor was being a little funky. And I didn't get my wand like I'm supposed to and relax those muscles when I should have. And I just kind of progressed. It got a little bit tighter and a little bit tighter. And then when I woke up yesterday morning, I definitely had more pelvic pain. I was having more gut pain and I was having more bladder pain. And I still didn't do it. Made breakfast for everybody. And then we had a little kerfuffle in my house. A little kerfuffle with my elderly father. And I just needed to leave. Before I said something I'd regret, I needed to leave. So I just drove away and did some errands. And as I was driving, I was like going, God, like seriously, I feel like I need to pee again. And I don't have bladder flares that often, right? I really don't have bladder flares. And then when I get to the furniture store that I was going to, because our recliner's breaking, like I needed to go to the bathroom and I needed to go a lot. And again, as I'm like going, okay, do I keep driving around or should I go home? Because then I was having some bowel spasms too. And it's like, okay, what do I do? And so I kind of headed on the way home, but I was like stopping at a couple of other stores. Then I made it home. And then it just like dawned on me, Jill, your freaking muscles were tight. My muscles were really, really tight. And so I had to get up. So once it dawned on me, it wasn't my bowel, it wasn't my bladder, it was my muscles. And then I started doing my muscle stuff. It all went away. Gosh. So, bladder pain, pelvic pain it's just very confusing because you really feel like it's your bladder. But in many cases, there are these little tiny symptoms that will point you in the right direction. I mean, we know so many patients, you do bladder therapies and you just don't get better. And we know that. Why? Because it's really not your bladder. So anyway, it just was just a reminder yet again to me that every time I start feeling those symptoms, and again, the earliest symptom is just when I go try to urinate. And if it's just not natural, if I don't have a good flow, if I'm stopping and starting, it should point me, and it should point you right to your pelvic floor muscles rather than your bladder. And it really is kind of heartbreaking for those of us who did bladder therapies for years, never getting better as our muscles continue to get worse and worse. So I don't know, just kind of a lesson, just a kind of a lesson reminder. I kind of think that I always look at flares as an opportunity to learn something. And it's a short-term flare. I don't have the flare anymore. I mean, it was gone by, I don't know, like 6 o'clock. I was a little nauseous though. Anyway, it's weird. It's just a weird day. That's what stress does. So what was our kerfuffle about? Our kerfuffle was about, I did a 2-hour TV show on Friday from 12 to 2. And I told my dad, I said, you've got to get mom up. I cannot get mom up. And we ended at 2:15. Great show. Really good. The tapes will be out probably in 2 weeks. Super, super happy with the way it went. And we're doing another one this Thursday. Anyway, so I'm like all happy. And I go out and my dad is spitting mad. He's like, why didn't you get your mom up? And I'm like, hey, I told you that I was doing a show. I couldn't do it. He was furious, like shaking furious. And it's like, wait. We talked about this. You said that you were going to get her up. And he didn't. And she wasn't up until after 2 because she sleeps like a log. Man, you got to work hard to get her up. And anyway, just like the stress level in my house went astronomical. It was very frustrating. And I really needed to leave yesterday. I really should have gone somewhere for the night, but I couldn't because I didn't have anybody to cover. Caring for the elderly is hard, and it's getting harder. Okay, Tara, she says, what are your thoughts on endometriosis and the role that it plays in the bladder? It plays a huge role in the bladder. That's why endometriosis and IC are called the evil twins. They're talked about the evil twins in research studies, and there are kind of three fundamental methods of action that are going to cement the relationship between endometriosis and IC. Number one, endometriosis can actually attach to the bladder. It can start pulling on the bladder. Endometriosis tissue or endometrial tissue is very tough. And so it can wrap around structures and start squeezing structures and minimizing blood flow. I mean, there are parts of it that are very, very challenging. And so if you have endometriosis attached to your bladder, it can actually work through from the outside in, all the way through and into and inside of your bladder. So there is a direct physical connection. The second thing we have to understand is when you have endometriosis, you're in a lot of pain. And because you're in a lot of pain, your muscles get tight. And of course, the legacy of tight muscles is, bam, restricted blood flow, ischemia, not only to the bladder, but to the vulva and to all the other areas down there. And so now we're dealing with potentially a long-term chronic muscle issue. And then the third thing we have to really consider is just the concept of neuroinflammation, that nerves get involved in the mix. Nerves, whether it's from the tight muscles or from the endometriosis or the pain of the endo, amplifying neuroinflammation, nerve sensitivity. There's no doubt that nerves get involved. The reason why it's important to know if you have endo is because bladder therapies are pointless. We have to control the endo. And that's why we want to have real tunnel vision into the concept of cause versus effect. Very, very important. Hold on a second. The other thing too now is that they're both getting hard of hearing, and so they end up yelling at each other. And you're like going, are you really yelling at each other like you're angry? Or are you just yelling at each other because you can't hear each other? I'm tired. Hi, Kaylee. Nice to see you, girl. I hope you're feeling a little bit better. Hi, Julie. Thank you. Terry says, can you talk about endometriosis and IC? I have to refresh my memory on what endometriosis means. Hold on a sec. Oh, well, I mean, okay, so okay, here, hold on a sec. Isn't it the same as hyperplasia? Endometriosis occurs when the tissue that normally lines the uterus grows into the muscular wall of the uterus. The displaced tissue continues to act normally, thickening, breaking down, and bleeding, each during the menstrual cycle. If untreated, it will lead to infertility and pelvic organ prolapse. You know, I don't think I've ever seen a research study that has talked in depth about endometriosis and interstitial cystitis and or pelvic pain. If the uterine wall becomes so thick that it's starting to push on the bladder, similar to a fibroid tumor, then that can certainly trigger the bladder. It's basically, it leads to an enlarged uterus. Yeah. Yeah, I haven't seen any correlation with that with IC, but it wouldn't surprise me if you have adenomyosis, and especially if it's severe, that it could be pushing and pressing on your bladder. I hope that helps, Terry, a little bit. Anne says, how do you know if your pelvic floor is tight? Well, okay, so when you go to pee, you can't start your stream right away. You might hesitate 5, 10, 15, 20 seconds before you can relax enough to release urine. You might have a burning sensation, like a vaginal burning sensation, because a muscle that's working hard burns. It produces lactic acid. You might have a pulling sensation or a pushing sensation, especially vaginally. Or you might be struggling with kind of long-term constipation. You know, that's important. Judy says, should you use the wand if you have a UTI or yeast? Well, I mean, it doesn't go in your bladder, so there's no reason to worry about the UTI. And with the yeast, I would be inclined to probably want to wait until the yeast is resolved a little bit. I wouldn't want to push it in further. I mean, I guess it depends upon where the yeast infection is located. If the yeast is in your bladder, you're fine. If your yeast is in your vagina and you're having vaginal symptoms, I probably would pass on using a wand. Terry, it's an unusual diagnosis. I mean, I wonder what the prevalence is. I have no idea what the prevalence is. I haven't eaten breakfast, guys, just so you know. So Laura says here, after 2 years of trying physical therapy, diet, urogyno, supplements, medications, your next step is a cystoscope with a hydrodistension or 6 installations. I'm afraid I may have lesions, so a cystoscope would help with that. I'm fearful to do it or not do it. I have a history of IBS. You know, so Laura, we do the hydrodistension when the diagnosis is in doubt. And clearly your diagnosis is in doubt because you're not responding to anything that you're doing, right? The question is, what meds were you doing? Were you doing bladder-specific meds? Were you doing bladder-specific supplements? And what the American Urology Association says very, very clearly is if you're not responding to therapy, if you're getting worse rather than better, it's time to take a step back and revisit the diagnosis, and let's make sure we understand what we're dealing with. It's been 2 years. It's time to get somebody to look in your bladder. And now here's the thing, Laura. Hydrodistensions are low pressure, short duration now. They're not meant to be aggressive. They're not meant to really stretch the bladder anymore. It's all about just taking a quick look at the bladder. And so you want to make sure that they're going to do it low pressure, short duration, as the American Urology Association says. But if you do the hydrodistension and your bladder comes back good, then it's time to look beyond the bladder. But if you do come back with Hunner's lesions, then look, they're going to treat the lesion. Make sure that you talk to your urologist about what they're going to do if they find lesions. They should inject them with a steroid or cauterize them according to the AUA. You don't want to have it again in 2 or 3 months to get the treatment. Normally, they do the treatment when they find them in the first place. But, I just don't want you to put all your bucks into the concept of a bladder issue or a lesion issue. There could easily be something else that they're missing. Like, for example, do you feel like you're carrying a bowling ball around in your pelvis? Do you feel a sense of heaviness? Well, then that could be pelvic congestion syndrome. So there's a book that, if your bladder comes back good, you're going to need to get this book. Where is it? Where is it? Now, none of these books leave my office, but my office is crazy. Where is it? Oh, come on. Well, it's called Facing Pelvic Pain. Facing Pelvic Pain. The book is on a runner. Anyway, Facing Pelvic Pain was produced by Harvard Medical School. Or no, it was produced by Harvard, not by the medical school. It was produced by the hospital. Anyway, the cool thing about the book Facing Pelvic Pain is it works through every potential condition that can cause all the symptoms of IC and pelvic pain, from musculoskeletal to neurological to gynecological to rheumatological. And so that would be the book that I think you're going to want to work through to see if you can figure out something else that could be contributing to your pain.
You okay?
Hold on. Hold on. Be right back. Are we doing okay?
Yep.
I am not into it today. I've got a little headache. All righty. All is well in the kingdom. The queendom. The queendom. Karen says, I'm in a flare after chiropractor adjustment yesterday. Mentioned the connection of IC and the pelvic floor, back, but he had no real help. See my urogyn Wednesday. I want to get to the root of the problem finally. Well, the fact that a chiropractic adjustment actually triggered a flare is kind of, cause and effect. So if he was manipulating muscles and bones and that triggered a flare, then that kind of tells you that maybe your issue actually is musculoskeletal, right? I think it would be very, very interesting to maybe have a proper pelvic floor assessment. If you have an underlying bony structure abnormality like scoliosis, a bad hip, a bad SI joint, a bad knee, working with a physiatrist, I think would be really helpful. Terry says, I'm trying out bladder installations. These are painful, but I will keep trying. Bladder installation should not be painful, hun. The only part of a bladder installation that should be painful is just your urethra when they stick the catheter in. So the actual chemicals, if they're doing the most popular installation, which is a rescue installation, which is a combination of lidocaine, heparin or Elmeron with some steroid and some sodium bicarbonate, it shouldn't hurt. So I'm a little bit concerned that what you're doing is hurting you. Are you doing DMSO? And if you are doing DMSO, it sounds like they might be doing too much. The FDA-approved dosage for DMSO is 50%. However, research was released to the American Urology Association many years ago that proved that the FDA-approved dose of DMSO actually caused muscle spasm, and in some cases, irreversible muscle spasm. And so the general consensus at that time, and this was 2 AUA meetings back in the 2000s, I think, that DMSO should never be done at that full dosage. It should be done with in a cocktail form with a lot of other ingredients that reduces that overall dosage, so you don't get that irritation. Laura says, I will get that back. Laura, it's look for Elise Day, E-L-I-S-E, last name D-E, Elise Day. She's one of the editors. Sylvianne says, I've been taking quite a bit of Preleaf. I'm just wondering how much is too much. It does help me. Well, hun, the calcium has to go somewhere. You should not be eating Preleaf like candy. You know, we don't want you to start throwing calcium-based kidney stones, which is possible if you do a massive amount of it. I would just be following the manufacturer's recommendations, 1 or 2 pills before you know you're going to eat a food which is risky. If you're not eating a food that's risky, there's no reason for you to take it. Preleaf does not do anything for the health of the bladder wall, at least that we know of. All it's doing is it's modulating the acid level. Okay, what's going on with my hair here? My hair is being weird. All right. Ruth says, I hope all is well, huh? You know, the kingdom is kerfuffled right now. Terry says, you're doing the rescue one for bladder. You had bladder spasms for a few days. Really? You need to tell your doctor that, because that's unusual that you would be having bladder spasms after the rescue. It makes me wonder if you're intolerant to one of the ingredients like lidocaine. There's some patients who do lidocaine and it does hurt, and they have to switch over to Marcaine, and vice versa. I would also want to know if there were any other unusual ingredients in it. So one of the things that happened to my friend Evelyn, who helped me start my first support group, is that she did bladder installations at home. They taught her how to do it at home, and she did them for years. Fine. She got the ingredients from a local compounding pharmacy in Marin County. Worked really well until one day she got her new instills and it burned like hell. Like, what the hell? Wait. And she called the pharmacy and said, guys, this is terrible. Why is this burning? And it turned out that the new pharmacist who put it together used a saline solution rather than DI water. And that saline solution is what triggered that bladder irritation. Remember, one of the earliest forms of torture was rubbing salt into an open wound. And saline in the bladder can be irritating to some people, whereas a plain, simple DI water is not irritating. So once they remade her installations and got rid of the saline, she was back and in good shape. Good morning from Sydney, Australia. Hello, Marjone. Hello, Jennifer from Janesville, Wisconsin. Marinda from South Africa. Wow, isn't it amazing? The internet, for all of its stress and conflict that it causes, you know, sometimes you really have to wonder, are we better off because of the internet? And like half of me says no, because of all the conflict and how it's weaponized. But then the other half says, yeah, look at this. We get to do support group meetings from our home. We get to talk to patients from around the world. We get, and Eddie says, hey, beautiful. Thank you. Oh, honey, thank you. I do think that, the support group, active support groups are dead right now. I think Angie called all the support groups on my behalf, and I think only one was doing Zoom meetings. I think all the rest were not doing any meetings at all. So I think we're just going to become more and more and more involved with online, which of course is leaving people out who aren't online. And there's, the most important people in your lives are the friends that you meet and the people who can help you physically, not just over the internet. That's something I always remind myself and think about, because I do think we all tend to be quite a bit isolated for one reason or another, whether it's COVID or elder care or IC. It's easy to nest at home and just kind of, it's like guarding, it's just like, leave me alone. I'm fine right here. Right. And we have to stop doing that. We need people in our lives. We need friends in our lives. I want more friends. I want more friends here. I do. It's hard. It's hard when your friends are far away. I just want to go. I want to go to trivia night again. I just sit and laugh and eat popcorn. Or go take a long hike. The nurse did tell me heparin causes spasms in some people until you get used to it. Really? I've never heard that. I've never heard that. Kayleen said, I went to the ER Friday night. I almost passed out in triage during a power outage, but they took me back right away. It was right after the pelvic pain was spreading everywhere. I did a UA and the color looked pretty good, but the results didn't. The nurse practitioner gave me an IV bag. She gave me Dilaudid, Meclizine, Zofran. It knocked me out for 3 hours, and the pain relief lasted for a day. She gave me Meclizine and Norco to take it home. I'm so frustrated that my OBGYN hasn't talked to me in 3 weeks, and I can't afford the time to go doctor shopping. Everything is sensitive and hurts. My urethra is killing me, and it still hurts to pee. You're hesitating to start. It's just as if I don't have my doctor. I have no one. Well, girl, Kayleen, not true, because you have all of us. I know it's hard. Your case is very complex, and I have a feeling that they are what's the right word? Actually quite intimidated by you, which is good because that gives you the power. But on the other hand, nobody likes to be backed into a corner, and doctors in particular, remember, doctors are taught to diagnose through observation. And so they look at you first, right? They want to look at your body. They try to study the anatomy, the physicality of what could be there. And if they can't see it, that's very frustrating for them. So then they go for lab tests. And if they can't see it for the lab tests, then they come back and they're trying to study your body. And that's when we start kind of getting that that doubt about the pain, because that's kind of when a doctor has to rely on their own experience. And if they've never had your pain, they will never understand your pain. If they've never had a severe bladder infection, they will never understand severe bladder pain. If they've never had endometriosis or hysterectomy, they will never get it. And we can just only hope that they are compassionate enough to believe you. But now you've got at least a record from the hospital and the emergency room to bolster your case. And so I am in awe of your strength. There are people that I work with every day Kayleen, you're definitely one of them. I have another friend, Lisa, who's one of them, who just, I'm in awe of your resilience and your strength and your determination, and just keep on keeping on, because you have a lesson to teach them. And we've got things that we hopefully will learn from this so we can prevent other people from suffering. But I'm so sorry that you're suffering. Good evening from Manchester, United Kingdom. Hello, Isabel. Nice to see you. Karen says, love to all my IC sisters and brothers. Marjon says, I can't find a support group in Sydney. Yeah, there really is not. There has never been an active Australian national group. Jennifer says, it's great to have support like this. Hi, Barbara. So if I'm looking here, I'm looking at Facebook. If I'm looking over here, I'm looking at YouTube. Karen says, thank you, Jill. That's really helpful. I did have an MRI on my back, and all they could tell me was that I had arthritis. I've never seen a physiatrist. I've suffered with lower back pain and SI joint for problem. Yeah, it sounds like a physiatrist would be a really good option for you. So, okay. So by the way, so I belong to several medical associations, and they have their own discussion boards. There's been a very, very, very good discussion on one of them. And I wanted to, and it really shows kind of how different doctors look at different things in different ways. Hold on, let me just see if I can find it. Hold on a sec. I want to see if I can find it on this computer first. Yeah, they were ripping yesterday. They were just ripping Friday and yesterday over this discussion. Is that a woman who had really, really unusual pain? Come on, where is it? Hopefully y'all got our newsletter. I sent out a newsletter yesterday morning, to about 50,000 people. And you know what? I got to say something here. If you're buying product from the IC Network on Amazon and you return it for a refund, and you buy it again the next month, and you return it for a refund the next month, and you buy it 4 months in a row, this person is buying Bladder Rest or something like that. 4 months in a row, they're returning it and asking for a refund. Stop it. That's not okay. That is not okay. You're taking advantage of us, and you're taking advantage of Amazon. We're trying to shut that down. Not okay. Okay, hold on. I'm still looking for this thing here. Where is it? I gotta find it. It's really good. Yeah, here it is. Here, hold on. Yeah, here it is. Okay. Oh, wow. Okay, hold on. Wow, look at all the responses. Oh, this is a really good case. So this is a 23-year-old who had 11 years of pain on the right side of her crotch. Sharp stabbing, burning, pulsating near the clitoris and the labia majora. Symptoms started at the age of 12. Onset of symptoms was around the time of a serious injury from a horse accident, falling on a saddle with significant bruising on the vulva and thighs. There were no fractures, but residual right hip nerve problems. Episodes happen once a month, not correlated with periods. Flares last 3 to 5 days. Intensity 10 out of 10. Aggravated by stress and a full bladder and long car rides. She was previously treated because they thought she had recurrent UTI, though her cultures were negative. She was diagnosed with interstitial cystitis, even though her cystoscopy was normal and her pelvic MRI was normal. She had no relief with any IC therapies: amitriptyline, azo, oxybutynin, IC diet, bladder installations, gentamicin, lidocaine, heparin, pelvic floor physical therapy, flared her symptoms after each treatment, vaginal Valium, topical estrogen, ice and heat. Nothing worked. And a lot of anxiety and catastrophizing now. Okay. So how many times have we heard something like this? So we've got a patient diagnosed with interstitial cystitis. We go back to trauma. What do I keep saying? Is there a history of trauma? This woman had a severe injury, horse injury, when she was 12 years old. Okay, and now she's 23. So this doctor is asking for help. Can anybody give me feedback on how to treat this woman yet? Any idea on what could be causing this? So let's look at what other doctors said. So one says manual physical therapy as tolerated along nerve pathways, and movement-based therapy that gets mobility and blood flow to the nerves without it being a threatening movement. For example, if a deep squat lights up a nerve, I may get them into hands and knees in a non-nerve threatening position. So that's from a physical therapy standpoint. Hold on. Now here's somebody who is a huge in the pelvic pain movement. My take on this patient is it's true neuro upregulation. The problem for us as a clinician is to find a diagnosis, whatever the original insult of many years, with many years of nerve, muscle, menstrual cramps affecting the original insult. By now, you really have to proceed with pelvic desensitization. Number 1, control the bladder symptoms. Number 2, pelvic blocks. Number 3, control menstrual flares. Number 4, locate all myofascial trigger points. And number 5, when the pain field decreases, you might be able to target the actual site. Here's somebody else saying she has to do more pelvic, have a really good pelvic musculoskeletal assessment, and that she may benefit from bottom-up somatic therapy based on EMDR or, okay, well, anyway, let's see. Okay, let me redo this. Okay, so this is like literally in the top doctors. He says, I see at least 3 or 4 patients every year with injuries that have occurred as a result of riding horses. Her history is classic. She very likely has a... Crap, I rode horses when I was young in 7th grade when my symptoms started. Okay, her history is classic. She very likely has a predisposition for high-tone pelvic floor dysfunction. This is related to the problems she had with her urinary tract in childhood. When she suffered her injury, she obviously has developed a pelvic floor hematoma. This is why severe bruising that went down the inner aspect of her thigh. This only further worsened her high-tone dysfunction. When patients have pelvic floor myalgia and high-tone dysfunction, they commonly will have problems of urinary frequency every 30 to 60 minutes. Okay, let me repeat this. When patients have pelvic floor myalgia and high-tone dysfunction, they commonly will have problems with urinary frequency every 30 to 60 minutes. She will never get her muscles to relax as long as she constantly feels the need to urinate. This is a basic concept of bladder pain syndrome. Her persistent hip problems need to be evaluated to make sure that her injury did not also trigger a labral tear involving her hip, as this would predispose to the persistence of high-tone pelvic dysfunction and episodes of flare. Her symptoms becoming flared with sitting, stress, and holding urine, as well as the pain that goes on for 10 minutes after urinating, are all classic pelvic floor symptoms. What do I keep saying? If you have pain after you urinate, we always look to the pelvic floor. The fact that physical therapy has been attempted yet it flared her symptoms is also another classic symptom of a myofascial origin of her pain disorder. What else has been done to help her pelvic floor muscles relax? Next time she has a flare, please do an examination to see if you can identify the trigger points and if you can do trigger point injections that might further support the diagnosis of pelvic floor myalgia. If therapy is directed towards her pelvic floor muscles, do not provide benefit. Let's see. If pelvic floor physical therapy does not provide benefit, then they're talking about sacral nerve stimulation. Okay. Do you get it? This is so important. Here we got one of the top doctors in the world now who's saying what we've been saying for 15 years. If you have pain after urination, we have to look at muscles. So your history of trauma is really, really important. And that really shows you how complex this can be. Let's see what else. Let's see what other doctors said. So, God, he nailed it. Here's somebody who said, my thought is she was very young when her pelvic pain started and had a direct injury to her pelvic floor. My questions would be, does she have scar or restricted tissue at the clitoris and the overall pelvic floor creating pain? The fact that she has increased pain with sitting can alleviate some degree and can alleviate it when sitting on the toilet. Sounds like pudendal nerve involvement. She's also had a long time for her entire system to be upregulated, and central sensitization can make it more difficult to achieve. I'm going to do an article on this. God, this is an incredible discussion string. Here we go. Here's one more. In my opinion, the description is fairly classic for neuropathic pain, intermittent burning pain in an area of numbness. It can be provoked by pressure on the area, such as pelvic floor physical therapy, that was trying to release an area over a nerve and trapped in a scar, or sitting for a long car ride. And it's relieved by things that release compression along the nerve, like pregnancy. My money is it's genitofemoral. It's very superficial. Okay, anyway. Fascinating, 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 fascinating. It's good to see. Now, if we can only get urologists to have these discussions, you know, I mean, this is a pelvic pain group. It would be nice to see the urology community getting in here and just really broadening their scope on why there are patients who don't respond to bladder therapies. Hi, Callie. Jennifer said a trivia night would be fun online. We should. It really would be fun. We could do. You know, I have done IC quizzes for prizes. Tanya says, I haven't flared in over a year, and bingo, I'm flaring now. Urine test was normal. It's vulva atrophy again. Wasn't using my estrogen cream. Back to square one. Why weren't you using your estrogen cream? Tanya said, is there a news food list? No. No. You know what? You guys can really help me, though. And that is, if there are any foods that we've missed, can you please email them? Because now that my magazine is done, we're going to be reissuing our diet list, our diet guide, and our flare guide in the next 6 weeks. So Isabel says, Bladder Installations helped me for 2 years until this year. I had first week of February, and I agreed with my consultant that instead of getting another installation in 6 weeks, I'd see if I could withstand it until April. But after 2 weeks, my pelvic pain became excruciating. I requested an early appointment, but as it happens, it will be in April. Well, Isabel, the thing about the bladder installations is they're not fixing anything. They're not fixing it. They're just covering up symptoms, right? So we have to try to understand what's driving your symptoms. What is the underlying cause? Is it Hunner's lesions? Is it estrogen atrophy? Is it chemocystitis? What is the underlying cause driving this? So it's very easy to get caught up in doing bladder therapy after bladder therapy after bladder therapy. And you kind of have to stop yourself from that for a moment. And you got to ask, okay, what can we do? Donna says, remember, Jill, you may be having a bad day. However, it's not a bad life. I try to remind myself when I have that really. Thank you, hun. It doesn't feel like it. I don't feel like I have a bad life. It's just confusing and stressful, you know? Judy says, how do we get our newsletter? You just sign up for it on our website. If you go over to icnetwork.org, a pop-up window will come up and you just put it in there. You get to pick which mailing list you want to be in. We've got different mailing lists. We've got our general newsletter list. We've got a diet list. We've got a support group leader list. We've got a pelvic floor list. We have a pudendal neuralgia list. We have lists for European IC patients, Canadian IC patients, Australian and New Zealand IC patients, Asian IC patients. So there's a lot of different lists over there. Yeah, but so the fact that your urethra hurts really points us to estrogen atrophy as an underlying cause, right? You know, that would be one thing. I have a really good blog on our website, the 7 causes of urethral pain. But what's really important about what you just said is that you have a line of pain that goes up your right side. So that sounds musculoskeletal, hun. The pain is so bad you cannot walk, sit, or lay down without pain. So if movement drives your pain, or if you have pain when you sit down, but it gets better when you stand up, then it sounds like you have muscles that are really, really tight that are squeezing nerves. You remember any traumas? Jennifer says you were blessed to finally get your teeth extracted. Oh, girl, congratulations. It's over. Teeth are annoying. They are so annoying. Like when I was a kid, our dentist hollowed out all of our molars and put silver fillings in them, all of them, literally for no reason. That's what they did back in the 60s. My sister, my brother, and I. All of those teeth, I've lost 1, 2, 3, let's see. I've lost 4 of them, no, 5 of them. And the rest are root canaled and crowned. I have put like $50,000 into this mouth in the last 10 years. It's ridiculous. Money, you know, thank God I had the money, but that's right out of my retirement fund. Which is why I have a water pick. I have fluoride toothpaste. I have fluoride mouthwash. And let me tell you, I do everything I can to protect these teeth because I don't have any money anymore to be able to do that. I really don't. Isabel says you have the same thing right side of your urethra. So again, right side of your urethra, that really, we want to look at your levator muscles on the right side of your body. Sometimes we see the whole right side involved. Mary says, how's your jaw? You know, my jaw's actually better. I've been doing my physical therapy. You know, this is my resistance. Or, right? But I'm still sleeping on the recliner. You can see it. This side of my face gets really tight. And you can see it in my smile that I can't smile as much on this side. But we're working on it. Oh, thank you for asking, Mary. Cindy says, do you know much about Botox in your pelvic floor? Well, yeah. I mean, Botox, if you have trigger points, if you have that are just really stubborn, if you've got right side muscles because of scoliosis and we can't fix the bone, so your muscles are always going to be tight on one side, then yeah, they're going to, they might consider, in addition to physical therapy, they might consider some Botox just to calm things down. Karen said, wow, so interesting. I broke my tailbone when I was younger. I'm making this appointment this week. Physical therapy only worked temporarily for me. So Karen, you need to get this. You need to get this book. You need to get this book. Anybody with a history of pelvic trauma, you need to get this book, because this book will explains everything. Where the muscles are, where the bones are, where the nerves are, and what happens when you suffer injury or trauma, if you have long-term persistent trigger points, et cetera, et cetera. This book is fantastic. I love this book. Love it. What does he say here? Love the section on trigger points. As long as you have a trigger point in a muscle, that muscle can never be healthy, right? Because if you look at the trigger point, which is a muscle knot, right? You can see what it's doing to the blood supply. It immediately blocks the blood supply. And that's bad, because your muscles and your nerves and your organs need good blood supply. Tight muscles restrict blood flow. Cindy said, your daughter has early menopause, and estrogen has really helped her urethra. It does. Jennifer said, but as my gums continue to heal, I could use some extra special help with my diet, please. I have been eating mostly soft foods. Trigger point. I mean, trigger points. What? Smoothies, my friend. Smoothies. I dislocated my jaw about 20 years ago, really badly. And I lived on trigger points. Why do I keep saying trigger points? I lived on smoothies for about 6 months until things got better. Karen, thank you for the 500 stars. Much appreciated. Jennifer says, but I'm trying to eat some harder foods. I've been using my upper palate to eat more nutritious foods like peanut butter crackers. You know, I would really be focusing on veggies. Oh, guys, by the way, wait, could pelvic flourishes cause compression on the urethra? Absolutely, 100%. Isabel says she doesn't remember any trauma. Betsa says, why do I find my piriformis muscles tingly kind of feeling? What it means to see what it means to see microscopic blood in the urine. Isabel, thank you for the 310 stars. Very, very much appreciated. You know, any of the, when the piriformis muscles are tight, they can cause sciatica. They can squeeze the sciatic nerve. So maybe that's kind of what's going on to a certain degree. Isabel says, one thing that has helped me with my pain is using the TENS machine. My husband attaches the pads to my back about 1.5 inches above the dimples. Yeah, that's good. That's a good place to put it. And think about it. The reason why that's helping is because it's relaxing muscles, which tells us that if you're having trouble peeing, it might be because your muscles are tight, which brings us right back to the circle of pelvic floor, right? Very interesting. Now, something else crossed my desk that shocked me. Absolutely shocked me. Let me get it. Hold on. Hold on one momento. Okay, so on my Twitter feed, up near the top, is a post by Dr. Eddie Ramirez. I retweeted it. Now y'all realize we are living in this weird science fiction world right now. It's like a 70s, 60s B horror movie that we're all going through with COVID and everything else. Life right now is just absolutely surreal. We know that. And we are all now really refocusing on viruses. And this was before COVID. You know, we had the research that showed that polyoma viral infections can cause Hunner's lesions, right? So we've all been trying to understand kind of the physical reality of why do some patients have Hunner's lesions. And we have multiple studies now which have found a very small amount of viral load in urine of patients with Hunner's lesions, specifically the polyoma virus, but it can be Epstein-Barr, it can be HPV. I mean, viral infections, not in everybody, just in a small group of people, viral infections are definitely possible. We certainly now know that COVID also can infect the bladder. We have COVID-associated cystitis, and I talked with 2 patients last week who have it. Here's some crazy ass viral news. Did you know that cows can get leukemia? I had no idea. I had no idea cows could get leukemia. Granted, I don't study cow science. But there is a virus that causes bovine leukemia. And it's very well known. So we've been trying to understand why breast cancer rates in humans have gone up substantially. And they started making a connection between the leukemia, the bovine leukemia virus, and human breast cancer. And now that connection is not only established that if you eat meat or dairy, or you get a blood transfusion from anybody who eats meat or dairy who has been exposed to this virus, this is a huge risk of breast cancer now. It's almost as severe as having the gene. Like the gene is like 4.6 risk factor. Well, this virus is a 4-point factor, whereas radiation, I think, is like a 1-point factor. So, I've got, there's this fabulous little 6-minute educational video, super, super easy, goes through all the research. And what shocked me in the end is that it's all about hygiene in dairies and cow facilities. It's about the rancher and the slaughterhouse practicing good safety techniques so that they're not cross-exposing things. 12 countries have now completely gotten rid of this by imposing very simple sanitation standards. But guess which country isn't doing a damn thing about it? The United States. So I don't want to turn you off from eating milk or dairy or beef, but damn it, this is disturbing. And there are many, 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 many studies about this now. I had no idea that cows could get leukemia, and this leukemia gets into humans, where it apparently finds a nice, happy place in breast tissue. And they say that it takes about, they said anywhere from 3 to 10 years of the virus in your body before you actually get breast cancer. So not to be Debbie Downer here. Maybe that's why my head is not in the right, I'm just like, life right now. Like, anyway, so so my Twitter handle is ICNJill. So go to twitter.com/ICNJill if you want to read it. I think you should, because honestly, Donna says, no shock, USA being up on current events. Yeah. This is why I'm buying more stuff from Europe. Like I won't buy American cookies like Oreos or anything like that anymore, or for me. I buy European stuff because they've already banned Roundup there, and so we don't have the Roundup contamination. It's just, we've got to stop putting profit ahead of safety. This is basic, simple safety. Those chemical companies are very, very invested in selling their product, and they will tell everybody it's safe even when it's not, just like with fentanyl. They told the doctors fentanyl was safe. It was not safe, just to make money. Judy says, why do we put TENS units on the back for bladder issues? Because you can't really get to the bladder either way, whether you put it on the front or the back. You can do both. The book that talks about that is this book, Ending Female Pelvic Pain by Issa Herrera. And we have not been able to reorder this. I have a feeling it's out of print now, but you might be able to get it on Kindle. And she has a section in here with diagrams on, here you go, right here, on where to put TENS unit pads. So I'll show you some of the pictures. Location of pads for the TENS unit. So here's one that's going up the spine, but also on both sides of the hips there. That's one thing. So TENS is a non-invasive, non-addictive, drug-free tool that helps many of my patients manage their pelvic pain. You will get a prescription from your doctor to get a TENS unit. Prices range from $50 to $1,000, so shop wisely. I mean, like literally $50 on Amazon. Many times insurance will cover the cost of the units. These soft conductive pads transmit low voltage electrical impulses to areas where the pads are placed. These electrical impulses suppress pain by blocking pain signals before they reach the brain. Pain relief varies among individuals. For some, pain relief is immediate as soon as the TENS unit is turned on. For others, pain relief continues even after it's turned off. Wearing a TENS unit can bring relief while doing your daily activities. Many of my patients wear smaller TENS units that can be clipped onto their clothes while working or traveling long distance. I did that. I flew to London with TENS units on. Finding the right placement and setting for your TENS is key in reducing the pelvic, bladder, and lower back pain. Work with your physical therapist to find the right energy pulse, depending upon the exact nature of your condition. Your therapist can also help you with the correct placement of the pads. So here you go. For sacral pain, you can put them right here on the lower back, right? For which one is this one? For lower back and glutes, which is where I have a lot of my issues. You got 2 on the lower back and 2 on the upper glutes. For the pudendal nerve, we've got the lower back, but you can see the pads are right at the base of the glutes. For the abdomen, here we go right here, kind of in a ring around the lower abdomen, right around the belly. That's for the bladder. So specifically for the bladder, she's recommending this position. But the thing about TENS units you have to understand is it should never hurt. If it's hurting, you're damaging nerves. More is not better with TENS unit and nerve stimulation. If you're turning it up, and you're thinking, okay, the higher it is, the better you're doing, and you're willing to grin and bear it through the pain, you're hurting your nerves. You cannot do that. TENS units should never hurt. Turn it back down until not even tolerable. It should not hurt, period. You should just feel kind of a little tingling, buzzing at the unit. Jennifer said, has anyone besides me had anxiety due to the war between Ukraine and... Oh yeah, definitely. Heartbreaking. Every day the stories are heartbreaking. And now an American news reporter was killed. But you know, come on. I shouldn't just say in America. I mean, it's too many people are dying for arrogant pricks of national leaders. Ukraine did nothing wrong. There was no reason to go in and destroy the country, which is what Putin is doing. They just want to live their life. just like we do, you know? That's why democracy is so important. And that's why it's so important that every vote counts, so that everybody has the right to speak their mind and not threaten. If you protest in Russia, you know you're put in jail. If you protest in the United States, you're not normally put in jail. You can say vile things to people and you're not put in jail. And there's irony there. But anyway, Isabel says it may be because it's close to the sacral nerve, which I think is related. Yeah. Lauren says, have I heard of the Mona Lisa touch therapy? My urogyne wants to do it, but it's very expensive and not covered. So yes, the Mona Lisa touch certainly has gotten a lot of attention since it was approved. I think it's approved for estrogen atrophy. Here, hold on a sec. Oh, what's that? We just had an earthquake. I just got the earthquake announcement. So, hold on, I'm looking for something. The FDA put out a warning. So hold on, I just want to find that. All right. So as we know, it's basically laser therapy. The underlying thought is that you're stimulating the tissue, which will then help the tissue grow healthy tissue, for lack of a better term, right? And so it's been recommended for people with estrogen atrophy, et cetera, et cetera. So the FDA in 2018 issued a fairly aggressive alert about Mona Lisa touch. So I wanted to find that for you. And immediately when I searched for it, we have data, we have adverse events reported to the FDA database. Okay, so hold on. Let me find this. Vaginal rejuvenation procedures are becoming more popular to relieve painful sex, especially in postmenopausal women. The FDA issued a stern warning to doctors Monday, advising them against using laser therapies to treat sexual dysfunction. The FDA Commissioner Scott Gottlieb was deeply concerned about women being harmed, and this is what they said. Vaginal rejuvenation procedures touted as a cure for incontinence or painful sex for older women can actually lead to serious adverse events, including vaginal burns, scarring, and even more pain during intercourse. The FDA issued a stern warning to warning to doctors, advising them against using laser or other energy therapies to treat sexual dysfunction and other problems affecting women after childbirth or menopause, saying it hasn't reviewed or approved the procedures. Quote, the deceptive marketing of unproven treatments may not only cause injuries, but may also keep some patients from accessing appropriate recognized therapies to treat severe medical conditions. These products have serious risks and don't have adequate evidence to support their use for these purposes. They sent letters to 7 manufacturers about inappropriate marketing of their devices for vaginal rejuvenation procedures. It's often referred to as designer vaginoplasty, revirgination, or G-spot amplification. The devices used for the procedure are approved to treat some conditions, including destroying abnormal precancerous cervical or vaginal tissues, as well as genital warts, but they aren't cleared to destroy or reshape vaginal tissue, which is done in vaginal rejuvenation. And so side effects include a burning sensation, bleeding that can last 3 days or longer after the procedure. So would I do it? No, I personally would not do it. And so here's an FDA alert. This is from a patient. My gynecologist performed a vaginal rejuvenation using Mona Lisa Touch Laser, which was approved for use by the FDA in December of 2014. 2 days after the procedure, I developed severe and debilitating bladder and urethral pain. I returned to the doctor twice within a 2-week time following the procedure, and both times had urinalysis performed, which were negative. I consulted with the urologist, who had no idea how to treat my symptoms, as he had not heard of Mona Lisa Touch. Once again, negative urinalysis. I left the doctor's practice and I'm under the care of a new gynecologist who is treating me with Vagifem daily. My doctors and I are in the dark as to how to proceed and what I can expect as far. There's no viable research on the internet regarding this procedure and virtually no negative comments. Yeah. Okay, so anyway, there you go. Terry says, I heard a lot of people got burned from Mona Lisa Touch. Yeah. Mary says, is Mona Lisa Touch the same as Sola? I don't know. Let's look. Sola is deep tissue photobiomodulation. They have a website, solapelvictherapy.com. It doesn't look like it's the same, but it applies healing light energy internally directly into your pelvic floor muscles. Doesn't sound like a laser. It doesn't sound like it's damaging tissues. It sounds like it's trying to stimulate some sort of healing response with light energy. The doctor featured, a couple of the doctors featured on this website are actually very top doctors in pelvic pain and IC. So I consider them pretty credible. Lauren says, okay, I'm not wasting my money. He also wants to do an IUD and I'm not doing it. Can't imagine these inflammatory devices helping IC. You know, the IUDs, in fact, there was a lady on TikTok, because I am addicted to TikTok. Like, I don't even read books right now. I just like go to TikTok. I've deleted off of my iPad like 6 times, and then the next day I reinstall it. I really, and now I'm doing TikTok videos on IC. But anyway, there was a TikTok last night of a woman who said how having sex ended up with me in the emergency room. And basically what happened is it pushed her IUD into an ovarian cyst and ruptured the ovarian cyst. So I don't know. We get a lot of stories from patients who are just absolutely intolerant to IUDs, and they have to get them out right away. I can't imagine having an IUD put in and you're in agony the next day and the doctor won't take it out. Some patients are forced to keep it for a month until they can get back into the doctor. That's crazy to me. I've just never gone there. Here, guys, let me just take a break. I got to go check on the folks, okay? Give me one quick sec. How we doing? You doing okay? Yeah. All right. You did your butter, and I did do your tea. Okay, and your furnace. So I'm gonna be done with this meeting soon. It's winding down. I think everybody's kind of tired. You know, never doubt the power of your intuition. Because I walked into the kitchen to find my mother sticking a sharp knife into a plugged-in toaster. The woman has no luck with toasters. Everything gets stuck. And then she gets a little sharp knife while it's freaking plugged in and tries to get it out. And it's like, stop it. No. Intuition. Mary says she likes TikTok too. Yeah, I mean, I was shocked that people are, you know, when we think about the internet, when we think about where people are, websites are dinosaurs now. They're just dinosaurs. So people, and now Facebook is a dinosaur. Now that group of social networking is falling out of favor because now it's all about short, quick videos, which is why we're filming a lot of short, quick videos. I can film videos all day, every day about topics related to IC. Are there any IC topics you'd like me to cover in a video? I mean, please let me know. I'd really love to know if there's a topic that you would like to see covered that I can do for you. Is anybody else like feeling like you didn't get enough sleep last night because of the time change? And you want me to do something on flares? I have a whole thing on flares already on YouTube, but I need to update it. So this is so I've already got it mapped out because flares always come up. So we're going to do a video on bladder wall flares. So with bladder wall flares, so let's say you have a flare because you had some alcohol or you drank a soda or coffee, right? So we know what our treatment priority for flares is. So number one, dilute your urine. That's in the first hour. Number two, alkalinize your urine. We got to try to reduce some of that acid load. Number three, do something that will try to numb the bladder, like an azo bladder pain relief pill. Number four, if you're after several days, you're just still struggling with the frequency urgency, especially if it's frequency urgency driven by COVID, then we're dealing with more chronic inflammation in the bladder, perhaps, or the neuroinflammation of the nerves in the bladder. That's when we're going to do a rescue instill and looking potentially at supplements that can calm nerves down, like Peora, Bladder Builder, right? Okay, so that protocol. Then we've got the pelvic floor flare protocol. So these are the patients if you flare after having sex or being in a car. And God, I'm really excited about this. So what are we going to do for these flares? Number one, we're going to use heat. We need to try to relax those muscles. Number two, we're going to do potentially a muscle relaxant. Something, again, like a vaginal Valium suppository. It's absolutely a must after sex for those women and men who have flares after having sex. And then you've got to use your wand. You got to get right in there with your wand and do your pelvic floor work and or work with your physical therapist. Pre-leaf is not going to help a bladder wall flare, right? So then we've got a hormone flare. So what do we do for a hormone flare? Hormone flares happen when you have a drop in estrogen levels. And generally for hormone flares, you kind of have to ride them out. But so realize that when your estrogen levels are low, your bladder wall is more vulnerable. And so you need to be following the IC diet, especially around the time that you ovulate, right before your period. Because your bladder wall can't defend itself as well because of the loss of estrogen, having something on board with chondroitin, a supplement with chondroitin in it, would be reasonable. It makes sense physiologically. So again, something like Bladder Rest, Cystomend, Bladder Builder, Cystoprotex make total sense for those of us who've had those types of flares, because it just gives you that kind of extra coating in your bladder to make it a little bit less sensitive and less vulnerable. And again, that's something you have to write out. You have to write out those hormone flares. They're generally short term. But what about the stress flare? Like, what about the stress flare? Like, seriously, you're driving in the car. So, like, one of the worst stress flares I had was driving up to Tahoe in a snowstorm. That's a 4-hour drive. And all you have to do is tell me I'm going to have limited bathroom access. I'm going to need to pee. Like, I was literally at a play with Patrick Stewart. And I had to get up, and I was sitting 10 rows from the stage. And I had to get up in the middle of his play and pee. I felt so embarrassed. I love Patrick Stewart, right? So all you have to do is tell me that I'm going to have limited restroom access, and I'm going to need to pee, and I'm going to need to have a bowel movement. It's just, that's the effect of stress on my body. So how do we deal with that? And that's a really interesting question. Number one, we have to take the anxiety out of it. So, for example, if you're in a car and you have to do a long car ride, you can stop the car and you can pee. Whether you stop at a Starbucks or a gas station, or you have one of these. Like, you can have travel johns in your car. You can, the great strategy is, if you have to pull over off the highway, you're on the freeway, and you have to pull over. You open the back seat, you open the front seat, so now you're protected. Nobody can see you unless somebody is on the other side of the freeway on the right-hand side. Hopefully it's in trees and there's no homes or businesses there. And you can just squat right into one of these and you'll be done in a minute. In and out, fast, right? I mean, this is what pilots do. I mean, there's a powder in it. As soon as you put liquid in it, it solidifies. You just wrap it up, throw it in the next trash can. You're good. So, or you can wear incontinence pads, or you can carry a big garbage bag and put a couple towels in it and literally sit on the towels and pee into the towels. You're good. So by taking out the worry about restroom access, that's really helpful, but that doesn't help being on a plane. Right? So you can wear incontinence pads on the plane, or you can do my plane strategy. So my plane strategy is number one, before I get on the plane, I already have Flexeril on board to stop my muscles from spasming. And I might even have a little bit of Norco on board if I've had pain, because it's a 2-hour bus ride for me to get to the airport, and the bus ride is really painful on pelvic floor. So I will often have pelvic floor spasms in the airport or getting to the airport. Okay. So you get to the airport, you check in, you go through security, and you go pee. You find some place to pee, and you just do it. Then you go to your gate, and as soon as they start boarding, that's your note. Get yourself ready to go to the bathroom. And as literally the second to the last call for boarding happens, run to the bathroom, pee again. Donna says, for plane travel, I sit next to the bathroom. But yeah, that's the best case scenario of all, right? Okay, so now you peed literally just as you're getting onto the plane. Then, as I get onto the plane, I pull the flight attendant aside and I say, listen, I've got a painful pelvic pain condition, and it really hurts badly if my bladder gets too full. So I may need your help using the restroom. Most of the time they're fine with that. You can have a little restroom alert card, a little medic alert card. You can show them. You can even have a letter to the doctor, right? Okay, so then you have to follow Donna's strategy, and that is, and I do this too, I have no problem sitting at the very last row of the plane right next to the bathroom. You know why? Because I can get in and out of there real quick. Bam. So then, as you're sitting there and they're still loading the plane, you can get up and go again. Now, granted, there's no pee there, but you've got the urgency, and that's just from stress. So you can literally run to the bathroom potentially, and they're going to give you the side eye, get in and out of there real quick. We are really fast peers. Okay, so now you're ready to go. The plane is backing. As soon as the seatbelt sign is on and the plane is backing, you cannot get up. If you get up, it is a big deal, and they go back to the gate. This is a big deal. You cannot get up. So now we've taxied. We're now at the runway. We're taking off. Good takeoff. And so then the thing is you have to practice the royal bathroom standard. And that is whenever a bathroom is available, just use it. So you're up, you've been in the air for 30 minutes. They take off the seatbelt sign, go use the bathroom again. Just go use it. Empty it out. Because you got a super sensitive bladder, empty it out. And it doesn't matter if you keep doing that. So I've flown to Europe doing that a couple of times. It's not fun, but I've done it. You can use a body heating pad on your belly. That delivers heat all 24. I mean, that will deliver heat for like a good 10 or 11 hours, perfect for the duration of the flight. You can wear 2 of them. You can wear 3 of them if you want. Okay, so now you're now getting close to your destination. It's maybe 45 minutes away. You can feel the plane starting to go down a little bit. That's your plan. You got to get up again, even if you don't need to pee. Get up again and go pee. And just know that once they are in that descent process, you really can't get up anymore. So I just say take advantage of every opportunity you can, and then just know as soon as you get off the plane, there are bathrooms right at the gate, and you can do that too. So that's my strategy. That is my tried and true strategy. But understand that that's why I hate traveling. Because, I have had bladder and pelvic and bowel issues since I was a kid. So traveling isn't fun to me. I'd rather be in an RV. Anybody with an RV in California, please come pick me up. Let us go take a drive somewhere. I would love to just go drive around the Sierras. I would love to just, there's a bathroom in the RV. We're good. What is a normal amount to pee in the day, not including nighttime? It depends upon your bladder capacity, hon. Donna says, it always helps me to go sit on a stool and relax. I think I missed something here as I was doing my little riff there. All right. Lori on YouTube says, I learned last week that my 2010 IC diagnosis was wrong for 12 years, an infection that ebbed in severity. Now a patient of a chronic infection doctor. Pathognostics guidance is important. I agree. Listen, I'm going to be the first one to say, yeah, chronic infection is possible. It's not everybody. I completely disagree with anybody who says everybody with IC has chronic UTI. It's absolutely not the truth. But a small subset of you might actually have infection, but it's not just bacteria. It could be fungus, candida. And we have yet another new study which has found a particularly virulent form of candida in the bladders and urine of patients with bladder pain. So having a pathognostic test, a microgen test that will allow the doctor to look at your biome just to make sure that there's nothing funky living in your urine is really, really important. It's information, it's data. And, I know that there are people out there who say that next generation DNA testing is a con. It's not. It's not. The research studies continue to show that it's far more accurate than urine cultures. It's data. It's just useful information. And if it comes back negative, then you can walk on. You can move on to other things. But if it comes back positive for some sort of funky infection, that's important. Also, Lori, listen, just so you know, they're also working on a chronic UTI vaccine. I did a blog on this, and it's fascinating. The early results are really good. It's called the Euroimmune vaccine. It's on our website. It's still on the front page of our website. We cycle through them. So here, hold on a sec. So the Euroimmune is a simple sublingual vaccine that could ease the suffering of millions of men and women. It is currently in phase 3 development, pre-licensing trials in 26 countries. So it's sprayed in the mouth, under the tongue, once daily for 3 months. It is composed of whole cell heat inactivated bacteria, including equal amounts of 4 common UTI pathogens: E. coli, Klebsiella, Proteus vulgaris, and Enterococcus facialis. I'm never quite sure how to pronounce that. Faecalis, facialis. Studies have shown that it causes innate and adaptive immunity, including the genitourinary tract. 40,000 patients have been treated with an excellent safety profile. 1.5 million doses have been given collectively. Most adverse events were mild and self-limited. And Dr. Curtis Nickel, the top IC doctor in Canada, is actually doing that trial up in Canada for this vaccine too. So he did a randomized placebo-controlled trial in which subjects were randomized to either placebo or vaccine. Women with recurring UTI, this vaccine significantly reduced the risk of UTI. The UTI-free rate in these patients who had on average 6 UTIs per year prior to vaccination was 55 to 58%. If patients did suffer UTI, those in the vaccinated group had significantly fewer symptoms and more self-limited diseases, just like we see with COVID. If you have the vaccine with COVID, significantly fewer symptoms, and it's a more limited disease. So this UTI vaccine is going to be revolutionary. Very, very exciting. Duke University. Oh, and then there's also another type of vaccine that is in development. Researchers at Duke University and the University of Colorado are introducing a vaccine containing E. coli directly into the bladder. They've only been doing it in animals, so they haven't done humans yet. So the Euroimmune clinical trial listings, let's see, it's in Canada and in several European countries, including, let me go there, I'll tell you where it's at. I haven't heard of anybody doing it in the US yet. Although it is available for use for compassionate use in the US, it appears. Belgium, Czech Republic, Denmark, Finland, France, Germany, Luxembourg, Netherlands, Norway, Romania, Serbia, Slovakia, Slovenia, Sweden, Turkey. So that's very exciting. Lori says, your tips have helped to calm the fire. I'm so appreciative. I'm glad, Hunt. Lori, I'm really, really glad that we can help just a little bit. Betty says, you are amazing. You've been so much help. You answer so many concerns and needs on my mind. Oh, I'm glad. You know, the most important thing I say to patients, literally when I talk with them as we are ending our conversation, is there is nothing about your case that frightens me. And that is true. It is really rare that a patient has a very severe disease process happening where they're hemorrhaging. If you were hemorrhaging blood, believe me, I would be worried about you. But the vast majority of patients that we work with, that's not happening. That their symptoms are explainable and understandable, and it's something as simple as that daily cup of green tea every day that's causing long-term chronic agonizing pain, right? And if you have estrogen atrophy, your bladder can't defend itself, and that's why you can't do your coffee or tea, but I know the pain's scary, but it's not a disease. There's no disease process happening in estrogen atrophy. Jennifer said, my parents used to have RVs, which was how our family of 6 was able to go on vacations. Yeah, I know. Now with the price of gas, holy hell. Jerry says, how big can Hunner's lesions get? How often should you get them burned? Can your mesh inside of you become loose if you fall? So number one, how big can Hunner's lesions get? I don't think I've ever seen a measurement, to be quite honest. I did show in our Thursday meeting a picture of Hunner's lesions, a brand new pictures of Hunner's lesions, and one of the pictures. So if your bladder's kind of like this big, the inflammation, might be in a 2-inch circle, right? So Hunner's lesions, or the inflammation around the lesions, could be quite sizable. How often should you get them burned? Well, the question is the burning working? So, and it's not really burning, it's laser therapy, cauterization, which, yes, it uses heat, so it is burning, but we call it laser therapy. The problem with doing the laser therapy is it's leaving scar tissue behind, which is going to impact the ability of your bladder to expand, to hold urine. So injecting them with a steroid it does not cause that legacy, and it's equally effective. So if the laser therapy isn't working, then considering the triamcinolone injection would be reasonable. Now here's the other thing, though, and I've shared this story multiple times. We had a case study published last summer of a woman with very severe Hunner's lesions and a very severe prolapse. So because the prolapse was impacting her daily life and she needed to be able to pee on her own, they went in surgically to repair the prolapse, and they found something remarkable. Her uterus was swinging. It had lost one of its anchors. So normally your uterus is held in place by anchors, by tendons, or no, ligaments, by ligaments, right? And so left side, right side, one of her ligaments was detached. And so her uterus was moving. So the back side of her uterus was facing frontward and the front side of her uterus was facing backwards. And what that was doing is that was causing strangulation around the ligament and the tissues of that area that were twisting. So they fixed that. So they got her uterus anchored in place in the correct position. And something absolutely shocking happened. Absolutely shocking happened. Her Hunner's lesions healed completely. Jerry, it healed completely. Now, I don't know if you're a man or a woman, I apologize, but that was what that case study shows us, though, is that Hunner's lesions can be driven from inside out by neuroinflammation, that clearly the tissues out of position had caused nerves to become very inflamed. Nerves that are inflamed release substance P, which is damaging to tissue. The fact that they were able to repair that and get the nerves untwisted and the blood vessels untwisted, and the fact that healed her lesions is just mind-blowing and very, very important. And by the way, I finally last week talked to another woman who had that same thing, posterior fornix syndrome. She had, and her case was fascinating. Lots and lots of pelvic traumas, and she was doing bladder therapy, and it's like, honey, stop for a moment, take a step back. And I educated her about the role of muscles and the role of positions. And she goes, yeah, when they went in, she'd had 4 C-sections. and then one other surgery that was very, very traumatic. And in one of the surgeries, that's what they found, that her uterus is facing backwards. So Jennifer, thank you for the 50 stars. Nancy says, I do appreciate the consult with you. My physical therapy let me borrow the SI belt as you suggested. You're getting relief already. Yes, Nancy, that's exciting. Oh my God. I'm so glad. See, I told you we were sisters, right? I told you. We are sisters in our health conditions. Joni says, just got my first results back from microgen testing, UTI that hasn't been picked up on a normal test. Doctor put me on 10 days of Cipro. Second sets of results should be tomorrow. I got the microgen kit very quickly. First results in 48 hours. Medicare paid in full. Yes. Okay. So Joni, what was the pathogen? What did they find? I just out of curiosity. The only hesitation I have here is that the Cipro, Cipro is no longer recommended for simple UTIs because of the many, many adverse events that can happen. And so, including, tendon ruptures, aortic aneurysm, things like that. But it sounds like you didn't have a simple infection. It sounds like you had a very complex infection. But what did they find? Jennifer, thank you for the 500 stars. So much appreciated. Joni says, how is the cystohydro? Okay. Took about a week to recover and the bladder pain is better. Rhonda says, I was diagnosed with breast cancer. Will it affect the bladder worse? Rhonda, the challenge here is that your bladder is going to be challenged by the loss of estrogen. And so my assumption here is that they have taken you off of all estrogen or I don't know how old you are. So they might have put you on Lupron or whatever to just try to keep your estrogen levels very, very low so that it won't help the breast cancer grow. And the challenge here is that the bladder really reacts to that. Think about your bladder for a moment. It's the only organ in the human body designed to hold toxic waste, ammonia, urea, irritants. So how can the bladder hold ammonia for hours at a time and not get damaged? And this is really kind of an evolutionary success story. Your bladder is like your mouth. It's a hollow organ covered with a really thick coating of mucus. And the purpose of that mucus is to be a barrier. All right. It's a barrier. It protects the skin from whatever's in your urine, whether it be a toxic irritant or whether it be a UTI. So when your estrogen levels drop, hold on. Okay. So protective effect. Unfortunately, that mucus is estrogen dependent. So when you're young, you have lots of estrogen, you have a lot of mucus and you can get away with stuff. When you're older, you have much less estrogen. Therefore, you have much less mucus. Therefore, your bladder's ability to defend itself is now compromised. And your uterus is gone, but the question really, it's not really about the uterus, it's about the ovaries. So just understand that your bladder will become more sensitive as your estrogen levels drop. And that's when you're going to want to follow the diet a little bit more because your bladder can't defend itself, combined maybe with something that will have a bit of a coating effect to protect the tissues. And Elmeron has its own issues now with the pigmentary maculopathy. The American Urology Association tells patients to try the supplements. So let me get the supplements so you can see them. Let's see. There's one. 2, 3, 4, 5. So the supplements that it's the supplements that contain chondroitin, which I believe are going to be the most important supplements because research has shown that chondroitin helps to restore the superficial integrity of the bladder wall. That was research presented at the Essex Society. So we apply that to kind of the supplements too. So we're really trying to prioritize chondroitin. So bladder rest is a very clean, pristine formula for patients who are more sensitive like me, where you don't like taking stuff because you're super, super sensitive. It's in an avocado oil base rather than an olive oil base. So it has in it chondroitin, L-arginine, quercetin, L-citrulline, rutin, and sodium hyaluronate. So this is kind of the best of both worlds. It's got a nice bladder coating effect from the chondroitin and the hyaluronate with a nice antihistaminic effect from the quercetin, okay? Then we have Cystoprotex. So Cystoprotex is the old tried and true formula. It's been around for 20 years, made by Dr. Theoharides, an IC researcher at Tufts University. This is in an olive oil base. Not quite the same ingredients. It's got the chondroitin, the glucosamine, and the quercetin. Well, and it does have, well, okay. So the only difference between this and the bladder rest is the bladder rest has a few more amino acids in it, and it's just the base. It's the challenge here ultimately is your level of sensitivity. So any of the supplements have the potential of causing some stomach upset. So when I was taking Cystoprotex, I could only take one a day. When I went to 2 or 3 a day, it upset my stomach or it gave me loose bowel. So I did better with just one a day. I don't come from the perspective of more is better. But anyway, Cystoprotex is still viable, and we still have patients who quite like it. But we have a lot of patients who really like bladder rest too. Then we have Bladder Builder. And Bladder Builder is the first supplement that, this is, in my opinion, the best supplement on the market because it has the most methods of action, because it has the chondroitin for the bladder wall, the quercetin, but it also has some beneficial probiotics. And most importantly, it has an ingredient for pain relief called PEA. And so this is viable. And we do, for those of you who like aloe, our aloe that we're now suggesting is called Aloe Path. So it has a soothing effect of the aloe combined with PEA for pain relief. And then we have the straight PEA, it's called Piora. Marianne YouTube says, why can't people use a low dose of prednisone? Prednisone is a miracle drug. Was on it once for a week when I had a bad IC flare. You know, prednisone long-term steroid use is specifically excluded as a treatment for IC in the AUA guidelines because of the risks. And I don't believe that there's research that supports that. But this does bring up another important topic that that I'm really thinking about, and I'm talking with a lot of other people about it, and that is the concept of autoimmune-driven cystitis. So again, we have our subtypes. So we got Hunner's lesions, bladder wall, pelvic floor, pudendal neuralgia, and central sensitization. We know COVID cystitis is real. We know genitourinary syndrome of menopause is real. And we also know that autoimmune-associated cystitis is real. That there is a small group of patients, small, like maybe less than 5%, who have Sjogren's syndrome, lupus, Zika, rheumatoid arthritis. And now they've got that autoimmune issue affecting their bladder. And so maybe, Mary, that was why the prednisone was helpful for you, was that it helped fight some of that inflammation. But as Jennifer says here on Facebook, prednisone has a lot of bad side effects. It does. Joni, getting back to Joni's microgen test. So they said you had a medium load of Enterococcus facialis, God, I don't know how to pronounce that, and E. coli. And so those are both 2 of the bacteria that are in the new UTI vaccine. So excellent. I'm glad that they found that. And let's see how you do with treatment. Hi, Becky. Nancy says, I warned all my family and friends about Cipro after I got torn tendons. Yeah. Jennifer said, I just looked at the website and saw the winter magazine has come out. Yeah, we'll be getting it from the printer probably on Tuesday, and it's already available on member pages. So yeah, it will be going out this week by mail to those who get it by mail. Otherwise, if you can, any of our members can, you can also download it and look at it right now. I really like this issue of the magazine because we're bringing up a couple of things that we really have never talked about, like scoliosis-driven pelvic pain. Scoliosis-driven pelvic pain. Do patients with scoliosis have a higher risk of pelvic pain disorders? Yeah, they do. And that is because when we look at pelvic floor issues, there are people who have long-term chronic pelvic floor tension. Why? What puts long-term chronic pressure on muscles but bones? And if you have scoliosis, the odds are you have one hip that's higher than the other, or you've got one hip that might be rotated slightly. It's hard to say. And what that's going to do is put long-term pressure on those muscles. And so for those of us with scoliosis, myself included, you know, this is going to be about maintenance, that we have to understand and accept that our bones are not quite normal. And because they're not normal, we are going to be much more prone to having tight muscles. So we've got to be very focused on that. I am hyper focused on that now. I now get it. I understand it now. I just have to be more proactive because I felt my muscles tightening up and I didn't do anything about it. And I had a little flare because of that. Nancy says she already downloaded it and you're talking about scoliosis. Appreciate that, and we'll read it. Also, I did a deep dive into rectal conditions. You know, I mean, we got to be real here. We have to be real here. If you got bladder issues, the odds are you have rectal pain at times, whether it's from hemorrhoids or referred pain or tight muscles. And so there's a big, long article on rectal conditions as well as on constipation. There is another issue on, here, hold on, let me get it. I think I threw out my draft. I did. I threw out my draft already, and I don't have the magazine. Here, hold on. Let me grab it real quick. All right. Can you believe we've been doing this magazine for 20 years? This is our 20th year. Pretty proud of that. Pretty proud of that. All right. So our winter ops. Okay. So in this magazine, my editorial is on the new UCLA subtypes, which completely support the Chris Payne subtypes. We have an article on Candida. We have yet this brand new study, which has found this very, very pathogenic bacteria in patients, fungus in patients with bladder pain. Got an article on the tailbone and tailbone injuries called Oh, the Mighty Tailbone. And then we have another one, Oh, the Annoying Rectum. And then scoliosis, pelvic pain. And then Stacy, our main writer, has a great article on relationships, how to keep relationships strong. A great article on pets and how pets can help us. And caffeine-free hot drinks to warm you up, etc., etc. Mary, I tried to call you. Honey, I tried to call you, I think on Friday, and I couldn't get through. We'll work it out. You know, Mary, if hold on a sec. Oh, I think I have you on my call list here. Yeah, I do. Mary, stick around, and after I'm done with this meeting, which will probably be in the next half hour or so, I will call you and we'll do it today, okay? And then I'm going to have to go because it's my best friend's birthday, and I'm going to have to go take her present. Isabel, okay, here, hold on. Isabel, can I please ask for the list of the books you showed earlier? I'd like to get copies of these. Isabel, they're right on in our store. Here, I'll give you the link. There you go. There's your link to the books. Florence says, I was just given naltrexone as a trial low dosage. It's an opioid blocker, usually used for drug and opioid abuse in high dosage. Have you heard about the trial? Yes, I have. And I don't believe the data has been published yet, but it looks interesting. It'll be interesting to see how you do. Anne says the squatty potty is excellent. Yeah. John says, what's the success rate of treating candida in the bladder? What is the best treatment? Honestly, I have not found a study that has talked about how to treat candida in the bladder. I haven't. So that's your question. We both have that exact same question. I looked, a month ago as I was writing that article, believe me, I was looking for it. I couldn't find it. And in terms of the best treatment, I think we have to really go on the guidance that we've learned from some of the really good books out there, like the Yeast Connection. And that is, you have to stop feeding it, which means you have to start reducing sugar content massively, because candida feed on sugar. And it's going to be antifungals like nystatin. And there's another one, the name is like right on the tip of my tongue. It's just not coming. It's fascinating. We screwed up our biome with all the antibiotics. So, that normal healthy biome where bacteria and fungus and virus live in harmony and we're not sick from it has been massively distorted since the 1940s when they introduced antibiotic. The only people who have a healthy biome now are the indigenous people who live like in the Amazon and or in some areas of Africa where they're not eating processed foods, they're not eating processed sugars, and they're not exposed to all that other stuff. So lots of urinary biome studies coming down the pipeline right now. Jennifer says, when my mom was on prednisone for her lung disease, she ended up getting a triple chin and caused her to have the requirement of needing to use the toilet an incredible amount of times. I believe it. I was prescribed, what was I prescribed prednisone for last year? Oh God, what? I didn't take it. Did I have a bite or something? Anyway, they gave me like a, oh, no. I was giving it for my ruptured disc. Yeah. They wanted me to take prednisone for 2 weeks for my ruptured disc in my back. And I was just like, yeah, I don't think so. Jennifer says, Mom used to know where every public toilet was in town. Tamora says diflucan for candida. The problem, Tamora, is that a lot of the candida now is completely resistant to diflucan and to any of the over-the-counter stuff, the monostats. The drug resistancy for candida is sky high now. And so, and I'm one of those patients where I had a treatment-resistant Candida glabrata infection for 2 years. And the only thing that killed it in the end was me. So I got it after doing Augmentin for three to 6 months, based upon the old theory 20 years ago that this was infectious. And so we all did that back then. We all tried long-term antibiotics. And I ended up growing this super drug-resistant Candida glabrata infection. And just when we would get it under control, it would flare again. And it flared every time I ate any ice cream, any milk sugar. Within hours, my bladder would be screaming because that milk sugar helped that Candida grow. And then so I did massive courses of diflucan. I did 450 milligrams a day, 7 days. I did that 3 or 4 times in 2 years. So that's where you're looking at liver toxicity. They have to monitor your liver. You're using so much diflucan. That would bring it down, but it always came back up. And the last thing that happened is I had a really severe flare, and it felt like I had a ruptured ovarian cyst. I mean, the pain was off the charts. So I go to urgent care. They whip out the sonogram. They look at everything. Your ovary's fine. Then they go, oh, we got to look. And so I strip down, get up in the stirrups, and the doctor goes, wow, I can see the candida burrowed into your vulva. I mean, it was obvious. I mean, he could see it. My vulva was covered, and I couldn't see it, but he could see it. So he said to me, he said, aren't you using the nystatin cream we're giving you with the diflucan? And I said, no, not really. And he goes, why? And I said, because I thought the diflucan killed everything. And he goes, no, there's not enough blood supply in your vulva to deliver the candida in therapeutic, to deliver the diflucan in therapeutic doses. And so that's why they give you the cream. The question now is which cream will kill it. And that's where the monostats would not kill it, but the nystatins would kill it. And so once I finally got into that regime of using the nystatin externally, it was the candida on the outside that kept seeding the constant candida on the inside. The other thing, I was working with a candida patient last week. The other thing that was really notable about that candida infection is I had no vaginal discharge, none. Only once in 2 years did I have a little discharge. It was just zero. There was no discharge. So it was just pain. There wasn't even itching. It was just pain. And the pain in the bladder was the worst thing I'd ever experienced in my bladder, far worse than a coffee flare. That active candida in your urine and in your bladder was agonizing. Like I was going to the gynecologist urgent care weekly for a long period of time. And they were just like, I saw every gynecologist they had. And in the end, when they did the scraping and then they looked at it, it was Candida glabrata. It was very obvious it was a drug-resistant Candida glabrata. So anyway, the lessons you learn, right? The lessons you learn. There have been a couple of meds that have really messed me up. The Augmentin was one. The second thing that changed me forever was Bactrim DS. So I was worried about getting UTI with sex. And so I asked the doctor, actually I asked the nurse for something that I could use before sex. So she gave me Bactrim DS, Bactrim double strength. I took one pill and my ears started roaring. It was in 2006. It was like having a semi revving its engine in my ears. And that lasted, well, it's never gone away, but that roaring sensation, 6 months before it finally calmed down. But I always have a high-pitched whine. I have Meniere's disease in my ears now, really from one pill of Bactrim DS. Very frustrating. And it's a very common side effect, tinnitus, ear ringing, very common side effect of some meds. How you doing, Dad?
As usual.
He says, as usual. He's not himself right now. He's just irritable and grumpy. And it all started Friday morning, and he got up and he just started watching Fox News and reading all this conspiracy crap on the internet. And he just got angrier, angrier, and angrier. It's just like shaking with rage at what he was reading. He has trouble differentiating between fact and fiction, right? So he's really falling for those conspiracy theories. No matter what we say, and my aunt who had COVID in the hospital, she is the That's the other piece of really bad news we got this weekend. So my house is not a happy house. She's not eating, and she's got atherosclerosis in her brain, but we think it's actually COVID in her brain. So her blood vessels in her brain are not normal. So she won't eat. So I don't think she's going to last much longer. She'll probably be gone in a couple of weeks. So Jennifer says Fox News it's just, what's sad is that it's preying on the vulnerable. I mean, he fought in World War II, right? I mean, like he's a proud American. You should have seen him on 9/11. He just had a heart attack, just had a cardiac pacemaker put in, defibrillator 2 weeks earlier. 9/11 happens. And I have to tell them that it happened. I've never seen a more angry man in my life than my father. And he wanted to get his guns and he wanted to go fight. You know, so he's a patriot in the best possible way, but not in how we define patriots today. You know, I mean, I come from a military family, Navy family. I got dozens of family members who were in the military. They all wanted me to go too. I almost did. Graduated from high school in 1978, graduated from college in 1982, and that was when they were just letting women in. And I will tell you that the story scared me about how women were treated, and that's why I didn't do it. I wanted to do it, but I honestly, I wasn't brave enough to do it and be one of those early women, you know. Tamara says, thank you, Tamara, for the 310 stars. Much appreciated. Much appreciated. But my brother was a nuke. He ran the nuclear reactor on a submarine. I got to visit it. It was great. Even saw the nuclear warheads. Yeah, that was scary. There was, for those of you who are worried about nuclear war, and we have to be real here because, Vladimir Putin is out of his head right now. And we have to pray and hope that he doesn't do that. I don't think his generals will do that, but he's fired most of his generals. I think he's fired 7 generals, including the equivalent to the Secretary of Defense. And so the ICers in Europe, are the ones that I've talked to, are really quite worried about that. But as another friend of mine said, who's also in the military, he said, listen, Jill, number one, our shield is really good. And the odds are very, very small that a weapon would arrive here. That said, we have so many submarines out there that all have their weapons pointed at Russia that if they did it, that we have a very strong defense. And it's terrible that we're even talking about this. It's terrible that we're here right now. You're right. Donna says no one can win a nuclear war. It's just shocking. I mean, what the hell? We go through global warming, explosive fires, extreme drought, a pandemic, crazy politics, a nation that was almost overtaken. And now we're dealing with a nuclear threat. I mean, the last time we did this was when I was in elementary school, where we all had to hide under our desks, and we did those warnings, and we had bunkers in the back of our house. My dad built a bomb shelter in the back of our house where they lived when I was born. I can't believe that in 2022 we're here again. So let us hope and pray that there are sane forces in Russia that will take Vladimir Putin's power away from him, and however that will be, right? And in the meantime, just to try to support the 2.5 million Ukrainians who have left the country, and pray for Zelensky. We have to pray that Zelensky survives, because you can bet they want him. That would be a very public execution if the Russians caught Zelensky. We have to pray for his safety, the safety of his officers, for all the foreign fighters who are going in. And it's just heartbreaking what's happening. And for the ICers there and the doctors there. And let's hope a year from now that we will be in a better place. Right? Donna says, your husband used to work on nuclear missiles. Yeah. Well, you know, when I was a presidential fellow, right? So I had a presidential fellowship. It's called a presidential management internship. It's now called a fellowship back. So I got that in 1987. And the job that I had job offers from virtually every branch of the government. And I wanted to work for NASA. So I flew back to DC and interviewed at NASA, and with this little apple doll of a woman. And the job that they offered me at NASA was to go down to Huntsville and interview managers after the Challenger accident to decide who to fire. And I turned that job down. I did not want to be a hatchet woman. I didn't want to be the woman everybody was afraid of. So the job that I accepted was on the F-16 program in the Air Force at Wright-Patterson Air Force Base. And I I had job offers in the Pentagon, job offers at military bases all around the country, job offers in other government agencies, but I was very focused. I wanted to do NASA, or I wanted to do something related to that. I have a lot of test pilots in my family. So I picked the F-16 program because there was a fundamental problem with the F-16 at the time. They were losing a lot of F-16s because a bolt had been put inside out. So there were all these congressional hearings. So the electronics that went from the cockpit to the tail, there was a pipe that went down, and the bolt was put in backwards. So the head of the bolt was on the inside of the pipe instead of the outside of the pipe. Thus, when the plane hit G's, the wires rubbed against the bolt and broke, and the pilots lost all position. They lost all their imaging to see if they were upside down or right side up. And so we lost, I don't know, like 18 F-16s and pilots because of this fundamental flaw. And what the congressional hearings showed and proved is that the company absolutely knew that it was a problem, but rather than issuing immediate corrections, they put it on their 1-year follow-up study or their 1-year follow-up plan. So they allowed planes to fly with this problem, and that killed American pilots. And that pissed me off because my family were pilots. My grandfather was a very famous pilot, actually. So I took the program to work on that. And so half of my job was working on the F-16. And then the other half of the job was working in New Mexico at Los Alamos on the ballistic missiles. And I never got into that. And it all fell through in the end. And I didn't get to do any of it in the end. There was a whole kerfuffle where my orders didn't arrive, and they found out that somebody had hidden my orders in the personnel office at Wright-Patterson because I was taking away a promotion from somebody who had been there for 20 years. So I actually never got to do it, which is but they apologized. And I still have the title, Presidential Fellow. Jennifer said, my brother-in-law's father has been tricked into believing that all of the fake news, and he has convinced my brother-in-law's family not to. Yeah, I know. My dad and my brother refused to take the vaccine. It's interesting that the women in the family are leading. You know, we're the ones that are leading the effort. I'm fully vaxxed. My mom's vaxxed. My sister's vaxxed. Her family's vaxxed. But the strong Republicans refuse. Can't fix it. I can't fix it. I'm sorry. I've tried. I cannot fix it. It is a pointless argument. All I can do with my brother, literally, is I just send him autopsy reports. I do. I do. Because again, I get all these, this medical stuff that you guys never see. And I just send in the autopsy reports and I just say, listen, I don't want this to happen to you. You're my brother. Yeah. And, it is what it is. Life is weird. Lots of interesting events. Somebody last night said, why aren't you a doctor? And in fact, Dr. Elise Day, who I was working with at Harvard, she said, Jill, why didn't you go to medical school? You would have been a great doctor, right? I mean, she said that to me, which is very nice. And the reason why I didn't is that when I did my surgical internship, I did not have confidence in my dilutions to prepare anesthesia. It just wasn't natural to me. And I felt that that was something that really needed to be instinctual and intuitive. And I had trouble with the math. I did. Even though I took calculus, and I wasn't bad at it. I wasn't perfect at it. It just wasn't good enough. I just never thought it was not good enough. And so my lab partners became doctors. And instead I went into psychology, and then, IC happened and stuff. And the IC network was my doctoral dissertation proposal to get my doctorate in psychology, but then I couldn't sit in the car for 5 years. So I couldn't even finish that. But I mean, the good news is we're rated #1 by Harvard. So I think it's okay. I think it's okay that, I don't have the MD or the PhD after my name. If Harvard has published what I'm doing with the other doctors, I'm the only non-doctor featured in Facing Pelvic Pain, I think I'm doing okay. Mary says, what's the best water to drink when you have IC? Spring water, just a good spring water. Mary says, yes, you would. You're so compassionate. Yeah. I mean, yeah, but we get to spend time. I think it's just like, my niche is educating patients and creating that connection between the patient and the doctor. And a lot of doctors send me their more complex patients, and I'm really, really happy to work with them. And so I can spend the time that the doctor can't spend the time. And then I get them back to the doctor with a new set of skills and a new set of information and a new set of questions. So that's kind of my niche in life. Isabel said, my IC flared up after I got my booster, but at least I have the immunization I need from COVID. The booster kicked my butt. Holy moly. That booster, I had the Pfizer booster. I've had all Pfizers. I was shaking like a leaf the first night, like 6 hours after I got the booster. Woo, man. This body was not happy, but it is what it is. I think that if I come back in life for my next lifetime, I think I really would still stay in health and medicine. But I want a lot of kids too. That's the thing. Isabel said, I had the Pfizer too. It was just excruciating urethral. See, I didn't have any bladder spasms or urethral spasms. What I had was a tremor, but I'm prone to tremor anyway. Like I have essential tremor anyway. So every now and then you can see my head doing this, right? And that's the essential tremor I've inherited from my father's side. And yeah, it's quite interesting. Thank you. You guys, thank you. You're very nice. You are very, very nice. All right. Well, listen, I want to go take some birthday presents over to my bestie. Carla says, whether you're a doctor or not, you're an educator is making a positive impact on it. Thank you. you know, it's funny because I love the fact, here's what I love, that when I started the IC network, I knew intuitively we, the IC patient population, had remarkable knowledge and power. I mean, there's no doubt about it. We have so many patients online who can fill out surveys and gather data. We have the ability to see trends most doctors can never see, right? And I will be doing I'm going to be doing a survey on autoimmune cystitis this week about what therapies work for patients who have autoimmune disorders. So that's going to be something else we do. So anyway, it's really kind of interesting being in this position where you have very clear trends. You know, like bladder therapies don't help patients who work with who have pelvic floor issues, et cetera, or Elmeron doesn't work for Hunner's lesions, or pigmentary maculopathy. Our survey of 2,000 patients was very important with that. And so it's really cool to see the language that I was the one who started using, 15 years ago, now being used by urologists around the country, because I'm giving you new language, which you're then giving to them, and they're going, oh, what a great way to think about it. Mary says so many don't have the time to deal with this. It's true. That's true. So my new trend, so we've got COVID-associated cystitis. We've got the new website, covidcystitis.org. And I'm working on a chemocystitis website and a GSM cystitis website. And I want to try to define autoimmune associated cystitis. So Jane Malink and I have been emailing back and forth about this. She runs the International Pelvic Painful Bladder Foundation in the Netherlands. And she posed an important question about subtyping. It's like, where's the subtype for autoimmune? And it's like, yeah, it's not there. Well, we need to put it in there somehow. And mark my words, 10 years from now, they're going to be calling it. So we really do have a lot of power in today as patients to try to get other people to look at things in slightly different ways. So it's kind of interesting. It's kind of interesting. So anyway, all right, guys. Well, I'm going to call it here. I really need a couple hours away from the folks and just hanging out with somebody where I can just bear it all. I might even cry. We'll see. I will see you guys later. Y'all have a good day. Facebook, we will probably see you again on Thursday. Instagram, I'm shooting for Tuesday, although hold on a sec. Let me look at my schedule here. Okay, it's a meeting at 10, physical therapy, that, Instagram, maybe Wednesday afternoon, maybe, we'll see. So, all right, everybody, I'll see you later. Have a good one. Go out if you can, stretch your legs, go walk if you can, if it's still sunny. If it's not, go sit by the fire and have a cup of something bladder friendly. And just take a few deep breaths and relax. All right. We will get through this. We are getting through this together. Joni says, will you be posting? Yes, I will be. Definitely. All right, guys. Okay, I'm going to say goodbye to YouTube. YouTube's gone. All right.